Welcome to TRT the artsy way. Today I'm going to talk about TRT or testosterone replacement therapy, also known as testosterone optimization therapy. Virtually everyone knows that testosterone is the male hormone, although women have some too. So why would someone want to replace or optimize testosterone? What are the signs and symptoms of low testosterone? What benefits can be realized by replacing and optimizing testosterone? We'll take a look at all of those questions and more. Before getting into the details and benefits of TRT, I first want to do a really quick overview of the 4Ms, since they are the foundation of health based on my 50 plus years of studying health, nutrition, and fitness. Boosting testosterone without addressing the 4Ms is just silly in my opinion. The 4Ms are microcirculation, mitochondria, metabolism, and muscle. I'll explain the role testosterone has in each of them as we go. Of course, we must also realize that a sound body structure and proper nutrition are also key, fundamental components of overall health as well. The microcirculation is comprised of tiny arterioles, capillaries, and venules. These structures account for 99% of the entire circulatory system, but you simply don't hear very much about them. This is the only place that nutrient exchange actually happens. The mitochondria are subcellular organelles that are responsible for production of approximately 95% of the body's total energy production. Without them, complex life forms would not be possible. Almost all cells contain anywhere from several hundred to over a million mitochondria. The average is around 2,500 by current estimates. There's a cartoon of a mitochondria on the left. Now, they're ancient bacteria that formed a symbiotic relationship with single-celled organisms billions of years ago, thereby radically improving the survival potential of both. They have separate DNA from the cell. The mitochondrial DNA is 100% inherited from the mother. Mitochondria can grow and replicate or shrink and die depending on the conditions. They are the only place where oxygen is used to fuel energy production. How important are the mitochondria? And what else do they do beyond producing the vast majority of the body's energy? Well, they also regulate calcium homeostasis. They regulate apoptosis, which is programmed cell death. They regulate the innate immune system, and they also regulate stem cells. Metabolism, the next of the 4Ms, is the sum of all the electrochemical reactions that take place in our bodies every minute of every day. There are literally trillions of reactions going on at any time. Over 3,000 different metabolic enzymes have been identified that help those reactions happen, and each one of them requires various nutrients and energy. The microcirculation delivers the nutrients and oxygen, and the mitochondria convert the energy into a usable form. Metabolism is extremely complex, too complex to micromanage. At best, we can support it. The most important way to support it is to make sure all key nutrients are available, as well as sufficient energy, whether it's nutrition, digestion, microcirculation, and mitochondria. Appropriate hormone replacement is one of the key things we can do to support metabolism. Muscle is next. Of course, everyone knows what muscle is, but do you know why it's so important? Well, it comprises the largest organ system in the body, accounting for approximately 40% of total body weight, unless someone is obese. It's among the most metabolically active tissues and contains the vast majority of mitochondria. Loss of muscle mass is directly correlated with aging. In fact, it is possibly the most significant thing associated with aging. It is the ultimate adaptive system of the body, allowing us to adapt to our changing environment survive, and thrive. It's malleable. We can increase it by stressing it. We can lose it by inactivity. That's where use it or lose it comes from. Muscle is our primary metabolic reserve, the only place where significant protein and amino acids can be stored, withdrawn, and redeposited. A decrease in muscle mass can indicate pathological processes such as muscle, nerve, and/or other chronic diseases, as well as nutritional deficiency and malnutrition. If muscle mass is below the normal range, it's referred to as sarcopenia. It involves reduced muscle strength, and it seems to be a precursor of frailty. Muscle loss can be concealed by an accompanying increase in fatty tissue. Weight may remain the same while the relative percentage of fat and muscle change, leading to sarcopenic obesity, which has become all too common, primarily in the case of older people. A reduction in muscle mass generally leads to a drop in physical performance, mobility, and quality of life. Consequently, skeletal muscle mass is a good indicator for determining the condition of health. How does TRT relate to the four M's and overall health and quality of life? Testosterone is the male hormone. It has many vital functions in metabolism. There are things that can help to open and reset the microcirculation. Interestingly, testosterone has vasodilation effects on the microcirculation. There are things that help restore efficient mitochondrial function. Increasing low testosterone is one of them. Additionally, mitochondria in the testes make testosterone. There are many things that can be done to support and help balance one's metabolism. Optimizing testosterone levels is one of the most important things you can do if your levels are suboptimal. What is optimal? This is a somewhat controversial topic and why you need an expert. There are numerous things that you can do to build muscle, and testosterone is the master muscle builder. Some recognized signs or symptoms of low or suboptimal testosterone: reduced libido, in other words, sex drive, reduced energy, reduced strength, reduction in height, decreased enjoyment of life, moodiness, grumpiness, depression, reduced hardness of erections, reduced motivation and drive, reduced athletic performance, and reduced work performance. Can you think of any man that would be happy and content with any of those signs or symptoms of low testosterone? I can't. Now, what are the potential benefits of testosterone replacement and optimization? Well, TRT has been shown to contribute to the following: its beneficial effects on mood, energy levels, and sense of well-being, improved sexual function, increased lean body mass, both muscle and organ mass, increased strength, increased erythropoiesis, which is red blood cell production, increased bone mineral density, improved cognition and mental function, and beneficial effects on cardiovascular risk factors. Now, for another rhetorical question, can you think of any man out there that doesn't want all of those benefits? I can't. If you're a man with any of those signs or symptoms, or if you know a man with any of those signs and symptoms of low T, it's time to take some action. You don't have to live with low T. There's one major problem and obstacle for getting proper testosterone replacement therapy. The vast majority of doctors don't know how to do it properly. It isn't taught in medical school, and it isn't part of conventional medical training, so many doctors are afraid of it. There's another problem as well. If it is done incorrectly, it could potentially backfire and make things worse. Do you want to take a risk with your health, happiness, and performance? The last issue that keeps men with low T from doing anything about it is the cost. Although some insurance plan might cover it, any doctor specializing in it will typically not take insurance for it. Insurance companies will typically only pay for things that they consider to be medically necessary. If you have a serious medical condition that has dramatically reduced your testosterone levels, they will likely pay to replace it. However, they will make you and your doctor jump through numerous hoops. It may also make your doctor a target of their medical board or other entities. It just isn't worth the risk for doctors unless they really know what they're doing and focus on it. That's why we have a wonderful doctor with over 30 years of experience heading up our TRT program. It's also why we developed a cost-effective model that caps your out-of-pocket investment and includes everything. For just $199 to start, which covers your labs, consultation, and exam, and then $199 per month that covers your medications, your follow-up consultations, and your follow-up labs. Therefore, you start for $199 plus $199, covers your first month, and then $199 a month thereafter. You're only committed for 3 months at a time. When men are young, we're largely controlled by our hormones, often to a larger degree than we'd like. There are pros and cons to this. On one level, it contributes toward the survival of our species. On another level, it can lead to violence, brutality, and destruction. As we age, we hopefully become wiser and not as controlled by our diminishing hormone levels. However, the amount of testosterone remains a powerful influence over our health, motivation, happiness, and sense of well-being. The true goal of TRT is not to make you into a young man or a bodybuilder. It's to make you a healthier, mature man with a renewed zest for life. It's about adding quality years to your life. So if that makes sense to you and you're over 40, give us a call to set up a consultation and lab test to determine if you're a good candidate for TRT. You'll be glad that you did.